guys, how are you? So today our topic is, see, what is this? So you might have already guessed it. So it is our kidney, right? Above that, what we have, our little glands, they are adrenal glands, right? So today our topic is today our topic is adrenal glands. So tell me, what are the zones in the adrenal glands, and what are the parts of adrenal gland? See, here we have, this is cortex, okay, cortex, and we have, this is medulla, right, medulla. So cortex is derived from mesodermal, okay, mesodermal derivative is cortex. Medulla is derived from neuroectoderm, okay, neuroectoderm, right? Okay, guess what? So tell me, what are the zones in the adrenal cortex? We know already medulla secretes only two hormones, that are epinephrine and norepinephrine. So forget about it and tell me about the cortex. What are the zones present? So there are three zones basically. So tell me. Zona glomerulosa, zona fasciculata, and zona reticularis, right? So which zone secretes aldosterone? Zona glomerulosa secrete aldosterone, and zona fasciculata secretes our cortisol, okay, cortisol or glucocorticoids, and zona reticularis is secretes sex steroids, okay, like DHEA, which is dihydroepiandrosterone, okay. Okay guys, up to now any doubts? So this is about normal physiology and everything, okay. Coming to now, and we have this also, like we have hypothalamus, this is rough diagram, okay, and we have, these glands, what, pituitary, this is anterior pituitary, and we have like hormonal nervous control is posterior pituitary from hypothalamus, and some vascular portohypophyseal anastomosis, this is anterior pituitary and this is posterior pituitary, right? So from here we will get what, cortisol releasing hormone. If this hormone is secreted from the hypothalamus, then we will have, from anterior pituitary we will have ACTH, right? We will have ACTH. So mainly remaining hormones also will be secreted under the influence of the hypothalamus from anterior pituitary, and posterior pituitary only stores the hormones like vasopressin and oxytocin, but our topic mainly related to ACTH, so I am talking about it. And anterior pituitary also produces like LH, FSH, PRL, means prolactin and everything, but main TSH, like that. So mainly today's topic related to ACTH, okay. So guess what I am going to tell today. Today I am going to tell about Cushing syndrome. So today I am going to tell about Cushing syndrome. So can anyone tell what happens in Cushing syndrome from physiology learning until now surgery? So Cushing syndrome will have increased glucocorticoids, right? Increased glucocorticoids. Okay, from where this increased glucocorticoids are coming? So it may be like exogenous also there or endogenous, okay. Exogenous means outside, from outside. If you are taking steroids for any disease you are suffering, then you may have increased cortisol, or you may land up in Cushing syndrome. Sometimes you will have endogenously what, guess? There may be primary and secondary. Primary means ACTH, independent will be there, and secondary is ACTH dependent. Secondary is from mainly any pathology in the pituitary. Okay, any pathology in the pituitary will end up in increased ACTH. This is happening in the 80% of cases, and then you will end up in increased cortisol from the adrenals, and you will end up in Cushing's, right? So and in primary you'll have in gland only there is pathology, and there is some adenoma or macronodular hyperplasia in the adrenal, which needs to increase cortisol production. Okay, in secondary you'll have like pituitary tumors or any pituitary adenoma coming, so it may leads to increased ACTH, which acts on the adrenal gland, which leads to excess production of the cortisol. And Cushing syndrome, the patient lands up in features of Cushing syndrome. So how can you identify the patient with Cushing syndrome? What complaints he will tell? So Cushing syndrome patient will comes with central obesity, okay, centripetal obesity and central truncal obesity and central obesity, and multiple red purple stria will be present in the abdomen. Pendulous abdomen will be there, and moon face is seen due to the puffiness, due to the deposition of fat, and you'll have a moon face. Skin changes will be there, skin changes due to increased stretching of skin, and you'll have a buffalo hump, and you'll have a subclavicular fat also you'll see. Okay, these are the clinical features of Cushing syndrome. Means central obesity you will see, multiple striae due to the stretching of the skin in the abdomen you will see, moon's face you will see, skin changes will be seen, buffalo hump is seen, and clavicular pad of fat will be seen. Okay, I'm rubbing off, guys. Okay, so what you will do, how you will confirm it? So in there will be loss of circadian rhythm here, there will be loss of circadian rhythm. So the patient will say so the patient won't say there is loss of circadian rhythm due to cortisol is 4 times increased than normal. Okay, so there is disturbance, so there is loss of circadian rhythm, right? After that okay, and you will do what you will do means urine free cortisol test. You will see 24-hour cortisol test from the urine. Okay, and even you will see in salivary tests you will find the cortisol will be corresponding to the plasma free plasma cholesterol, please free plasma cortisol, cortisol. So this correspondence will be there, and this is what happening, urine free cortisol you will doing, and you will do this, and you will do dexamethasone test, dexamethasone test means you will do low dose like 1 mg dexamethasone. So for normal individuals the levels will be less than 1.8 microgram per dl, and for corticos means increased Cushing's patients you will see greater than 10 microgram per dl. So this is characteristics of Cushing syndrome. So when you will say means if you have and how do you differentiate primary from secondary means you will see urinary free cortisol levels. Okay. Then in negative DEXA means then you will find you will say it as primary. Okay. And so how do you confirm your what do you do, what is your Still, what investigations do you want to do? You want to do CT or MRI? CT, MRI. Okay, for pituitary tumors, to find out, to rule out pituitary tumors. Okay, and you have to even you have to do from inferior petrosal sinus, you should be collecting blood, and you should be seeing the levels of the cortisol. Okay, so ACTH levels and cortisol levels. Then if it is greater than 3 grams, uh, then you will say it is from secondary, it is from pituitary. Okay, ACTH, if it is ACTH, okay, not that cortisol, ACTH. From pituitary, ACTH only will come, no? It is greater than 3, then the central to peripheral ratio, if it is greater than 3, then you will say it is from pituitary. Pituitary pathology is there. Okay, and you will do even for CT, you should do for sure. And what treatment you will give? Medical treatment will be there, and you will have surgical treatment will be there. Medical treatment, metirpone and ketoconazole. Ketoconazole. Okay, this will be given. Surgeries you should do from like transpenoidal approach. Okay, transpenoidal approach in case of secondary pathology is there. And you should do if lumbotomy, posterior lumbotomy from you should reach the kidney, right? So you are reaching from back, means lumbar vertebra, so you are doing lumbotomy. Okay, and through abdominal also you can go through the kidneys, and you should do that. And you can do in case of any tumors is there, any cortical tumors, you should do unilateral adrenalectomy. If there is any macronodular hyperplasia like that, you can go with bilateral adrenalectomy. Okay, that's guys today. Thank you. I hope you understand. So just revise all the points. So we had taught what is adrenal. So first we have drawn this picture, and we had found out what are the parts of adrenal gland, like cortex and medulla. And medulla cortex we have zones: zona glomerulosa, zona fasciculata, zona reticularis, and zona glomerulosa melanocorticoid. Zona fasciculata will have cortisol, and zona reticularis will have sex hormones like DHEA. Then we talked about zona fasciculata, which is secreting cortisol, and circadian rhythm is disturbed due to increased cortisol, which is greater than 4 times. And we had said even the origin of them, and means cortex is origin from mesoderm, and medulla from neuroectoderm. Then you went for clinical features of Cushing's, and moon's face, buffalo hump, clavicular part of fat, central obesity, buffalo hump, like skin changes, multiple striae. This all we had gone through. After that we said investigations like urine free cortisol test and dexamethasone test. Okay, we went through that. So, and secondary, what is secondary and what is primary, we had taught. So later we talked about the treatment, what treatment we are going to give, and in surgery, medical treatment, surgical treatment, and CT, MRI also we talked in diagnosis. And this is guys all about Cushing syndrome. Thank you guys, thank you so much for listening patiently. Hope you guys like this video. If you like this video, subscribe to our channel, and share this to every friends, so who are close and close to you. And if it is useful, write like, share and subscribe. Okay guys, thank you so much.